Hello, welcome again. This is the second video on PDH monitoring case study. I hope you had a great discussion within your group and with a larger group in your class. In this video, we are going through some of the questions from the first video assigned to your team. The first question was to look careful at the datasheet from the PDH session at Sunshine Village of Happiness and complete the nutrition status for day 1. Do the same for day 12 and also complete the weight gain. Did you have any question about the information provided? What was the question? Was the question clear? Did you discuss within your group and the larger group? So this was the monitoring case study datasheet provided. Each group was supposed to complete the areas in gray and then provide feedback. By now you have already noticed that this can also be done using the PDH Excel spreadsheet or the online database. However, we feel that it's important for you as a supervisor or a DMINI technician or a DMINI officer to be able to know how this is calculated so you can provide timely feedback when you visit or monitoring a hard session. This table should look familiar to you by now. These are the results you should be finding in your team. After completing the nutrition stages and weight gain around day 12 and day 1, your results should look similar to this table. On this screen, we are only showing the child number 1 to 10 because those are the ones that needed to be completed. However, keep in mind that for every calculation, the total calculation and the hard monitoring, you should consider from child 1 to 23. We can see on the nutrition status that for child number 1, Shadeen, the nutrition status was severe. We can see for Elena, child number 2, the child was healthy and should not be admitted into the PDH. On the right column, we can see if the child has gained adequate weight after 12 days. So yes, if the child has gained 200 or more grams, and no, if the child did not gain 200 or more grams. This is easily calculated by subtract the weight on day 12 with the weight on day 1. The next 3 questions are: calculate the number and percentage of children who have gained adequate weight during the hard session. What can you say about the hard session? What's going well? What needs to be improved? And based on this data, what action will you take? Calculate the number and percentage of children who had gained adequate weight should be fairly simple. You just need the total number of children who have gained 200 or more grams during day 12 monitoring, in this case a 20, and you have to divide by total number of children in your data set, which is 23. In this case, we have 86.9% of children who have gained adequate weight, and 13.0 did not gain adequate weight. What can you say about the hard session? What's going well and what needs to be improved? Overall, it seems that there's a good progress in this heart session. Almost 87% of the children have gained adequate weight. This is a good progress. But remember that there's also 3 children who did not gain weight. So it's important for us to review the data to provide follow-up and to see why that happened. You can go back to your table and identify specific children who did not gain weight, 200 or more grams. You can see from this screen that child number 4, Kalpana, did not gain 200 or more grams. So this also, the last child, Ruman, actually has lost weight. This is important to follow up. You can go back to the heart session. You can call the community health volunteer or the staff responsible to supervise the heart and follow up with the mother to see, has the child been sick? Has the child been admitted to the hospital? Did the mother attend all the heart session? Did the mother miss most of the heart session? Is there any problem with the scale? Was the child correct weight? All this you need to take into consideration when analyzing the data. Overall, you can see the average weight gain for this heart session is around 261. This number is actually quite close to the 200 gram. So it's a good sign that probably the weight is being correctly taken. And also the progress across the heart session, it's good. But remember that we want to make sure that everyone is gaining weight. So based on this data, what action would you take? We saw that the data seems quite good, but we still need to provide a follow-up on the 3 children who haven't gained weight. Plus, we also need to provide probable follow-up to the weight gain of Shadeen, because 800 grams seems a little bit high to be a gain in a period of 12 days. Keep in mind that children with severe malnutrition admitted to heart tends to gain weight much faster than the other children. But still, 800 grams in 12 days seems to be a lot. So make sure that the weight was correct taken. What are the other actions that you need to take? For most of these children, probably you will just recommend to continue monitoring up to 1 month. But also, please provide feedbacks to the mother or caregiver of children who have gained 200 or more weight, to support them and encourage them to continue practice the good behavior. Also, provide follow-up to the children who are not gaining adequate weight. The question number 2 was to complete weight gain and catch up and the nutrition status around 1 month. So your result should look familiar to this one. We have already covered this one for the day 1, and now we have here the results for 1 month. So this should be simple to you right now, and you should have used the WHO weight for height reference tables to calculate the nutrition status. But you can also use the Excel spreadsheet or online dataset. The adequate weight gain for the 1 month is calculated by subtracting the weight from 1 month, and weight from the first day of heart. The first question was calculate the number and percentage of children who have gained adequate weight during the month, then calculate the number and percentage of children who have changed their nutrition status, and final, what does the data tell about the children? The process to calculate the number and percentage is the same explained for the day 12, and this should be the result tables from your group. Either you do this manually or use the Excel spreadsheet. So you can see after 1 month, only 2 children have improved their nutrition status and 21 did not improve. And when you look into adequate weight gain, you can see that 17 corresponding to 73.9 have gained adequate weight gain and 6 did not. And the average weight gain is 452. The average weight gain also seems very close to the expected. And the adequate weight gain, it also seems good, around 73.9. But it's a little bit worrying that only 2 children have improved their nutrition status. This period from 12th day of heart to 1 month is probably one of the most challenging period because mothers no longer have that group support of meeting every day, have the other mother and caregiver providing that encouragement and support, and they start to face new challenge at household level with new family member, lack of support, lack of specific food to be able to design, to be able to cook the recommended menu. So this is very important period that community health volunteers need to provide constant visit and support and keep encouraging the mothers so they can provide the nutritious food to their children and also continue to practice the appropriate behavior that was learned during the heart session. So what does the data tell you about the children? Again, as I mentioned before, it seems that the average weight gain seems good and also the number of children, but it's still a little bit worrying that only 2 have improved. This can be due that most of children were admitted with maybe severe malnutrition, so they take longer to change their nutrition status. Also, children admitted with mild nutrition status can take longer, 1 or more heart sessions to be able to change into the normal nutrition status. So all the time when you see the data, you need to go back to each individual child and treat one case as unique and provide follow-up to those cases. For instance, we can see that Jania was admitted as moderate and is still moderate, but we can see that the weight change and the weight gain has been positive. Actually, after 1 month, she has been able to gain 600 grams. So it seems that the progress is good. However, when we look to Kalpana, we can see that she has even worsened her nutrition status from day 1 to 1 month. And she has gained no weight during the 1 month period. So this probably is a case that you want to a closer monitoring and follow up. Provide home visit to see what a challenge the mother is facing, if the child is sick, if the child has been admitted to the hospital, to check for the water, sanitation, and hygiene condition in the household, to check if the mother is facing any challenge to cook the menu, if the knowledge and the behavior are present. All these are very important to be able to achieve good results during the heart implementation and PD heart monitoring.
You can also check for Simul. It seems that Simul has even lost weight. After 1 month, the child has lost 100 grams. So you should provide same follow-up as you provide to Kalpana. So how many children would you recommend to repeat the heart session? Remember, with the new version of PDH, we no longer repeat heart session after 30 days. We continue monitoring and provide support to every child, and we repeat heart after 3 months. So next, you're supposed to choose 2 children and answer the following question. How has the child progressed? Is this satisfactory? What change, if any, would you recommend for child over the next month? So we have already covered that, looking into Genia and looking into Kalpana, Genia, and Simul. You always need to go back and look to the child to see if they are evolving well or not, and provide recommendations, special visit, supporting visit, and to see if the mother is facing any challenge. It's also good to encourage mothers that are practicing the good behavior and let them know that the child is gaining good weight and it's improving, so you can reinforce their positive behaviors. Next question, how would you explain the child's progress to the caregiver? What does the data tell you about the heart program? What action do you need to take? Always try to explain to the caregiver to the simplest language possible. Do not use a lot of technical language. The community might not know the exact definition of malnutrition. Always use local language if they don't know. Always encourage the caregiver about all the effort and commitment that she is putting toward the rehabilitation of her child. Always trying to find some of the challenge that the caregiver might facing at the household level and try to work to overcome those challenges. It's not always easy, but most of the time it's possible. Monitoring visits are very important to see what the mother has been practicing. Also to reinforce some of the knowledge and practice from the PDH session. Some mothers have not completely understood how to design or how to prepare the menu at household level. So take this opportunity to reinforce that. Sometimes the mothers might not have all the ingredients for the menu preparation. You need to find replacement. Or sometimes it's okay to not have all the menus, all the required component for the menu. So what does the data tell you about the heart program? We can see here that the average weight gain is good, and most children have been gaining 400 or more grams. So probably for this heart session, we will continue monitoring. But always keep in mind that you need to follow up with some of the children who have not been gaining weight or even losing weight. Also, please double check for the outliers, such as the first child who has gained almost double the weight, the expected weight. This might be normal, but sometimes the weight is 3 or 4 times the expected, so you should look into that. On the last question, you have to look at the result and complete the nutrition status using the weight for age z-scores. So your results should look similar to this table. Again, you have to calculate the percentage of the child who have gained adequate weight. Do you see any trends and concern? What does the data tell you about the program? What action do you need to take? After 3 months, we can see only 2 children have graduated from the program and 20 did not. This is very worrisome. When we look back into the 1 month data, we could see some trends here on the improvement in nutrition status. Although the weight gain the average was around the expected, and we had high number or percentage of weight gain of children with adequate weight gain, we could see that the percentage of improvement was very low. And during the follow-up visit, it's also important to look for the other component that might influence in the nutrition state, such as water, sanitation, and hygiene, the household food security, and the other positive behavior associated with nutrition, such as responsive feeding, good child care, even something like the mother workload. All these can contribute to the child nutrition status. What other action needs to be taken? Remember that at 3 months, it's our graduation period. It's when we decide who is going to repeat hard, who is going to continuous follow-up and monitoring at household. If you're using an Excel spreadsheet database or the online platform, you will see the recommendation who should repeat hard or who should be continue monitoring. This is based on the nutrition status and the weight of the child after 3 months into the program. For this particular program, we can see that most of the child has to repeat hard, so this is not good. We can see that from the day 12, it seems that the program was doing quite well. There was some progress up to 1 month, but the data started to look a little bit worrisome because we only had 2 improvements on nutrition status. From day 12 to 3 months, it's a very crucial period because it's a period of follow-up. There's a lot of challenge that the caregiver can face at the household level. It's very important that we continue to provide home visit to support positive behavior and encourage the mother to continue to practice what they have learned during the heart session. It seems that this program haven't done well. So after 3 months is a time of a review to see what needs to be improved. We had a very poor rate of graduation. If we look back into our graduation rate, we can see that only 2 children have graduated from the program. So what we need to do, we need to go back and revisit our program to see some of the key components of our program. Starting from the train, have the volunteer been appropriate trained to conduct heart sessions? Did the mother understand the contents of the heart session? Are they practicing at home? Do they have enough support? Even going a little bit further back, look into the positive device inquiry. Was that correctly done? Did we identify the positive practice in that in that community, the positive deviance practice? Are the mothers able to practice that? Did we identify the PD foods? Are the mother able to cook that at the household? Do they have access to all the necessary ingredients for the menu? The weighing. Are the volunteer taking the weighing correct using the correct technique? So when you look into the data, you have to think about all that and always going back to provide follow-up and to give reflections with the volunteers, with the mothers about some of this challenge and how to overcome. As you move into the new hard sessions, you will find new practice, new challenge that you will have to learn in community with the volunteer and the mother how you can overcome them. Only by continuing learning and revisiting and providing monitoring and follow-up visit, you will be able to identify most of the challenging practice and work with the mothers and volunteers to overcome them. And this brings us to the end of our case study. Thank you.